Welcome back to Ahead of the Curve. I'm your host, Dr. Megan Teed, and today we have a guest returning for the second time, Dr. Mary Grimberg. Welcome back, Dr. Mary.
I was just about to say, welcome back to you. Um, Thank you for having me back. I'm excited to be here. You crack me up.
Um, so we had Mary on, I say we, I mean I don't know why I like say that sometimes, like I'm multiple people. Um, but I had Mary on, gosh, several episodes ago, episode 18, and this is going to be episode 75. That's
Man,
hard to believe.
yeah.
So, in our last episode, Mary and I talked about um, postpartum stuff and scoliosis. And today we're going to talk more about preparing for pregnancy and pelvic floor stuff and scoliosis. So, um, for anybody who didn't listen to that previous episode, episode 18, tell us a little bit about yourself, kind of how we know each other, even what you've been up to.
All righty. Yeah. So my name is Dr. Mary Grimberg. So I am an orthopedic and pelvic floor physical therapist. I did extensive training in orthopedics many years ago with completing an orthopedic residency, sitting and passing for my OCS, and really dove into orthopedics head on. And what I found is that at least the majority of the population that I was treating that were female weren't getting the results that, especially if they had children or even not, they weren't able to kind of get these results that I thought they should be. And even though men do have pelvic floors, it's just different, right? Because we have our periods and we have children and all these different things, right? And so I kept kind of resisting going into it because I was like, I don't know if it's for me. I don't know if it's for me. And now that I'm in it, I am just in love with the profession because these topics are not talked about and can be literally life changing. And I'm just excited to talk about them and go from there. But so I have an orthopedic and pelvic floor practice here in Austin, Texas, with two other physical therapists. One is an orthopedic and pelvic floor physical therapist, Dr. Arista, and then Dr. Nick is an orthopedic physical therapist. And I also have my own podcast called Sex and Wellness with Dr. Mary. And I need to look up what episode you and I did together, but we kind of touched a little bit more on this as well. And then you and I met in Krista Gurka's mentorship program last year, just hit it off immediately.
Yeah, it's been really fun getting to know you and learning more about the pelvic floor world. And, I've taken a few certifications in like pre-postnatal Pilates, and then I did another pelvic floor course that was like kind of orthopedic and pelvic floor stuff, like preparing for pregnancy and afterwards. That was really, really great. It was with the New England Pelvic Collective, Dr. Jen Morgan, and I can't remember his name right now, but yes, with them. And anyway, I just feel like there's always more and more to learn.
So much.
Pelvic floor is super underserved. Scoliosis is super
Oh,
underserved. The combination of the two are even more underserved. So I feel like this is just a topic that we can continue to talk about probably until the end of time and always have something new to.
yeah. Well, it's when you're chronically dismissed, and I've dealt with chronic illness majority of my life, so chronic fatigue, and then I underwent cancer treatment for Hodgkin's lymphoma in 2019. And so my point of saying that is that I know what it feels like to be dismissed and to think you're crazy and to think that you're hopeless. And I just made it almost my life's work to make it that people teaching them how to relearn and trust in their bodies, because the more power you have, the less anxiety, the less fear, the more empowerment, right? The better decisions we can make. And so, as much as my journey has been really tough, it's really helped me open my eyes to this. I mean, this is my calling. No ifs, ands, or buts about it. So, no
Yeah.
buts about it. And I'm so, yeah, but
Yeah. I mean, learning as much as you can, you said, to make better decisions. I think that that is pretty much the key to so much of this, because when you don't know, then you start trusting in other people more than you trust in yourself and your own intuition. And that's a really dangerous and scary place to be. Uh,
right.
and I know that you've experienced that firsthand, I'm sure, through cancer treatment and being
Oh
a
yeah,
family
being
mom, going through.
misdiagnosed, telling me I'm fine. I'm like, no, something you know when something is off, right? Like there's also anxiety, right? So there's anxiety where you're worried, you know, there's there's that, right? But when your nervous system is more in a calm state and that like subtle intuition's like, hey, it's like kind of like a nagging, not nagging, it's just like, hey, check this out. Hey, check this out, right? And
Mhm.
we're not taught to listen to that. And so I've really encouraged like my patients with pelvic floor dysfunctions and even just anybody in general, like the more power we give external, the less we learn about our bodies. And so we've set up this whole healthcare system is meant to look externally for validation, which, yes, we do need that. Don't get me wrong. But you need to be a part of the decision making as well, because the more educated you are, the better decisions you can make. And there's been countless times where I've had patients say, I wish I didn't have that surgery. I just wish I knew more and I wouldn't have.
Mhm.
And there's nothing to like from there. We just have to move forward. But the biggest thing is that really is important is when we're talking about the pelvic floor, because there's a huge tie to emotional stress, traumas, and triggers. And so as you start kind of bringing more awareness to this area, which we tend to dissociate from, just
Mhm.
because there's a lot of shame and guilt and fear around the genitals, just in general. And that is a man made construct, right? And so the more we can look at this as a beautiful part of our body that is our anatomy and understand it, it can really change your life.
Um, that is the exact thing that happens with people with scoliosis. They completely dissociate it from having scoliosis. They don't want to think about it. They don't want to look at it. A lot of people are ashamed of it. So layering all of this on top of each other is kind of a tangled web.
Yeah.
Um,
And it's just
yeah, go ahead.
for people to know like you're not alone. And it is scary to kind of look an illness straight in the eye and be like, I don't want to identify as this. And you don't have to identify it, but it doesn't have to be you're the person with scoliosis. It can be, oh, I'm Megan and I happen to have scoliosis,
Yeah.
right? It's a part of your story, but it's not your identity. And so
Mhm.
we think that is kind of where things shift, right? Because, I felt the same way when I told my journey. I was like, I don't want to be this person that's always talking about my illnesses or my history, but I want it to be a part of my story so people can say, oh, she gets it.
Yeah.
She's not just talking,
Mhm.
just she gets it. And so
Yeah.
that's kind of why I like to talk about that, because we talk about the pelvic floor, it's a mind body connection, it's a full body experience. And that's why my orthopedic background is super helpful as well, because you can kind of see how it's all interrelated.
Mhm. Yeah. So just in general, can you explain the importance for like a baseline person that doesn't have scoliosis, why preparing their pelvic floor is so important prior to pregnancy for that pregnancy?
I think number one, it's not even just preparing, it's more even if you're not even having children, but yes, especially if you are, is just understanding what is happening in your body, because then you can ask the right questions, right? So if we understand that, hey, birth can sound really scary to some people, but when you start to understand what the steps are, what is actually changing, what's occurring, right? I would say the biggest thing is let's talk about basic anatomy, right? I don't want to say normal anatomy because that implies, there's abnormal, but it's more of like this is a general understanding of the anatomy, and you can look up any picture. Maybe we can maybe tag like a pelvic floor picture in here, like I'm the one doing this. Just have you. But I think it's important for people to visualize. So if you're listening to this, think about your pelvic floor being shaped like a bowl, okay? And you have your rectum, which is where poop comes out, and then you have your vagina, and on top of that is your uterus, and then in front of your vagina is your bladder. And just to kind of visualize that area, right? And so that's the pelvic cavity. What happens during pregnancy, right? The uterus is on top of those. When you see the image, you can see it's on top of that area. So when you're actually growing during pregnancy, you're growing more in the abdomen. And over time, the baby slowly drops into the pelvis. And then that's kind of when that can sometimes be later in pregnancy. It can be right before giving birth, a variety of different things. But so you're kind of seeing visually, okay, where everything is and where to feel. The other thing that's really super important is weight distribution. So your center of mass. So basically, if you stand up and you hold a weight outside of your body, right? Your center of mass, it's going to be harder for you to keep your balance. You almost have to shift your weight a bit more forward, right? And or you have to counterbalance that, right? And so by the counterbalance, yeah, you're going to have to potentially I said that wrong, lean more back into your heels to kind of balance that. And so what happens during pregnancy is you may have heard, I don't know if you've heard this term called mom butt. Not that you lose your butt, it's just that we kind of tuck the butt under to adjust for that center of mass. And what you can do is kind of play around with standing and just kind of shift your weight forward and backward, move your pelvis back and forth, move your mid back and forth, move your lumbar spine. So just kind of learning, how to kind of potentially get a little bit more of those movements, which is going to be more challenging with scoliosis. But the point is more just to bring awareness to those areas. A lot of this is bringing awareness. And so from that point of view, then you think about, okay, the thing that's holding up all your pelvic organs are ligaments. And so those connect, like, so for instance, the uterosacral ligament, that is a ligament that connects from the uterus to the sacrum. Okay. So sometimes, especially like if you're having a painful period or things like that, that can kind of tug more on the sacrum, so the lower part of your low back, and potentially cause some back pain. Also kind of pressure in the area simply because you don't have a ton of space. But the point also is sometimes even people during pregnancy, they might have pelvic pain of heaviness. And that's can be sometimes because of the pressure all day long, being upright against gravity. So practicing just different movements, like even kind of a modified like prayer stretch where your butt's up in the air and you're breathing through your abdomen, and that can kind of take some of that pressure off of your pelvic floor. And so I'd say the biggest thing is just kind of starting to play with different movements, starting to look up, the anatomy, be like, okay, this is what this is how to move. And then the other thing that's super important too is hip mobility, because the hip is the side, some of those muscles are the sides of the pelvic floor. And when you think of giving birth, right, the baby is coming out of the vaginal canal if we're having a vaginal birth, and then the muscles around the vagina widen, right? They're muscles. And so that's also important too, because when you work on breathing and hip mobility, those are loosening some of those muscles to allow for giving birth.
Yeah. Okay. So you're saying probably top three things generally are focusing on learning anatomy, learning the pelvic anatomy, um, playing around with weight distribution, which is something that people who have scoliosis and they're in a scoliosis specific coaching program, PT program, that's one of the first things that we do because most people are holding their weight all on one leg. And then even further than that, they're usually holding it more so back in the heel or the forefoot. So I think that that aspect is going to be a huge thing for somebody that has scoliosis because your feet are your foundation and everything kind of trickles up, so to speak, from the foot and the ankle and um, really understanding the way that you need to distribute your weight sounds like it would be a huge thing. And then hip mobility as well. Um,
Huh. Yeah.
So, based off of the anatomy of somebody who has scoliosis, so there's some strange things that happen. Um, you have a torsion that happens through the vertebrae of the spine, and you have three dimensions to the curve that affects the rib cage. It affects the pelvis. Everything has a rotation and a torsion to it with scoliosis. How how would somebody's preparation for pregnancy look different, from probably your traditional clients in that aspect as far
Well,
as their
thinking
anatomy?
about like this minor repeated movements that you're doing all day, every day, right? And so you and I have talked on my podcast about how even just addressing the asymmetries in your strength, right? Because if you tend to hike up more on the left side, right, you might need to strengthen more the right and lengthen the left or add more torsion or whatever specifically it is, building up that strength, that functional strength.
Mhm.
And then the other thing to kind of think about too is even just trying, there's so many different positions that you can give birth in. And people aren't aware of them because what we're put is a position where you lay on your back with your knees up and you push. Now you tell me who poops that way? You don't poop on your back.
Maybe
Like,
babies, maybe babies.
okay, maybe.
Not
No,
even babies though.
they're usually like around like a corner, like if they're toddlers or like pooping behind a couch,
Yeah.
but think about it with gravity, right? So try even just practicing different positions just to kind of see like, oh, where do I feel restriction? Is my hip tight here? Or, so you can start feeling more comfortable in your body as you progress during pregnancy. So birth isn't as scary, even if you're not pregnant, just kind of learning more about these different things. But the other thing that's interesting to kind of think about too is, so say if you're pregnant or you're trying to be pregnant, think about the positions that you're going to be doing all day, every day. So for instance, if you are, so say your curve, you have more of a curve to the right, okay, in your lumbar spine. When you set up the baby's room, right? Think about, are you going to keep going into that curve and getting the baby out and then up and out and then up? So I would say, even being like, think about ergonomics, like put the baby on the left side, right? Because then you're kind of working with your curve versus against it. And so just kind of thinking about things like that can also make a big difference. But the biggest thing, if they're already in scoliosis programs, is just really learning, hey, breath work, connecting their brain to the pelvic floor, especially if there's a history of dissociation of the body. Get a mirror out, look at your vulva, spread the labia, look at the tissue. Um, and I know it sounds like really basic stuff, but I'm telling you, it's a game changer.
Yeah. What would you say is the biggest mistake that you see people making when they're trying to work on their pelvic floor to, get stronger or even,
I
you know,
think Kegels are the answer.
yeah.
Half the time, everyone's squeezing their butt and vaginas because they're stressed out, or there's asymmetries, right? Especially with people with scoliosis, they may be tighter more on one side of the pelvic floor than the other. But more so just kind of thinking about it's not just Kegels, right? It's more of, your core is is three-dimensional, right? It looks like an egg. So the top part is an upside down bowl, the bottom part is a bowl, the front part are your deep abdominals, and the back part are your paraspinals. And so learning how to engage all of that in the positions, working with your curve,
Mhm.
and that can help you prepare for pregnancy as well. But the thing is like Kegels, if you think about it, when you're pushing, right? I hate to compare babies to poop, but it's just like I think people can understand it a bit more, right? Because it's a different hole.
Everybody has experienced that, yeah.
Yeah.
Where
Yeah.
I mean, everybody's pooped, so they can relate to it.
For that book, I need to put that in my clinic. Everybody poops.
You do.
Um, I do. I should put it out like a thank you for supporting us. I don't know. But my point is, when you poop, do you squeeze your butthole?
Yes.
It's gonna push it back up, right? You do that when you're like, I don't know if you've seen this thing where people are like talking about,
Not to poop.
well, yeah, people are saying this happens in like TJ Maxx, like all of a sudden they go shopping. Have you seen this at all? They're like, I'm fine, and then once I go into the department store, I'm about to, can I curse or no?
Yeah. Yeah.
Shit myself. And so you would contract then, right? You would contract. And
Try
so
not to.
yeah, I mean, unless you want to, you know, poop in TJ Maxx, but that's fine. But the point is that you want to focus on kind of relaxing those muscles. And so the more you can even get a mirror and just see, like when you do your pelvic floor contraction, look at the vaginal opening and the anus. And you should see that there's a middle part. It's called the perineal body, but that should almost kind of disappear, or you see less of it when you pull up. And then when you push out, you can see more of the anus and vagina. And so the more you can kind of feel that difference, it can be a big difference in helping you understand. But the biggest thing is that Kegels are not always the answer. I mean, sometimes they are a little bit, but it's like, you know, it's it can be, right? And sometimes people actually don't do them right. They actually push down and pull up. So that's the biggest thing.
Mhm. Yeah. Would you say that maybe a rule of thumb, would you say that it would be wise for any person who's considering getting pregnant, going through that, to have a pelvic floor assessment?
Always. But I
Yeah.
also recognize that there's a lot of limitations with that, right? Like if you're in a small town, there's likely not a pelvic floor physical therapist. There's not enough of us. And then on top of it, cost. Most are out of network with insurance. And so it's more of, hey, if you have access to somebody, and not all pelvic floor therapists are created equal, unfortunately. There's a lot of focus on internal treatments, which I think, I don't know that we need to look at the full entire body. And so maybe somebody that potentially has both orthopedic and pelvic floor experience, but that's also super hard to find as well. But I would say, yes, find a pelvic floor physical therapist, talk with them to kind of see, hey, what are some things to work on or not work on? Or some things that you have tendencies already, like maybe tend to have back pain or XYZ with this now. So seeing a physical therapist and seeing, okay, well, what can we do to kind of counteract some of those forces as you get pregnant, as you continue to grow.
Mhm. I feel like I want to put us on the hook here and say that we're looking in the future to put together something online for people who either want to get trained as a movement professional to help people with scoliosis navigate pregnancy and beyond. Um, we've also talked about it being more client specific, but just you talking about the need and the lack of people out there to help. I think that that's a good thing to put us on the hook
Well,
for.
yeah, and I'd be interested to see when people reach out to you or comments that people say on this episode, because the more like we want to help, right? But also we're not exactly like marketing or sales professionals, like yes, we have our business, but we're heavily trained in physical therapy. And so the more data that we can get directly from our ideal clients, the better. So we need that feedback on, hey, that's a great idea, this or this. um, we're business owners, so it's a learning curve, right? But just kind of thinking about what are some things that we can do that would be helpful, or things that people really need.
Yeah.
um, and so yeah, the access to care is really really limited.
Mhm. Yeah. And even if it's, something as simple as a webinar initially, just for people to have a little bit of basic information so that they have a roadmap of, okay, like, where do I go to get help for this? And, just people don't know what they don't know. And there's
Yeah.
so much help out there, but also you want to know that you're getting the good care and accurate information about things. So,
I think this is the thing that I hear a lot of. Why have I not known this? Why has nobody told me? And that's multiple issues, right? If we are in the United States, our healthcare system is not set up for teaching people about their bodies. It's a reactive system that makes more money on pharmaceuticals and surgeries, right?
mhm,
So, and then we have pelvic floor physical therapists like you and I, and you know, the marketing budget is going to be a lot different than a surgery center or a pharmaceutical company, right? We're talking millions and millions in marketing. I mean, if I had millions and millions, hell, I mean,
everybody would know.
everybody would know, right? And so we have to, that's kind of part of it too, is that there's this lack of awareness because the people that are doing it, they don't know how to get that message out, or maybe they don't have the understanding of how to do it the way a pharmaceutical company could. Do you get what I'm saying? And
Yeah.
so the more we can educate ourselves, the better. And I think that, like I said, the biggest takeaway I'd say from us talking is number one, look at your vulva. I know it sounds weird. I know. People cringe. And I think part of that is due to a misrepresentation of what vulvas look like.
Mhm.
A lot of people are thinking it looks like what you see on TV or pornography or in anatomy books, and it never looks like that. Like it never does. Sometimes one lip is longer than the other. Sometimes the labia minora is a lot bigger. Some it's smaller. Sometimes we have more hymenal tissue. Sometimes we have different color labia. All these different things, all normal. And
Mhm.
so I find that there's a huge hesitant on even looking at the area because of the shame and guilt that we get as women in
Mhm.
our society and in general.
Yeah.
Um, and so if you're too nervous to even look, that's totally okay. Just think about it. Just kind of bring awareness to it.
Mhm.
But then the next step would be looking at the area and just being like, okay, this is the labia minora majora, my clitoris, vaginal opening, the anus, and just seeing, and then pushing out, pulling up, just observing, right? And then you can start, just even understanding like, oh, when and then standing up, right? And then standing up and kind of shifting your weight forward, backward. How does that make my body feel? How does this feel with my curve, right? And so the second thing is, yeah, bringing awareness to kind of the weight distribution, because it's the more pregnant you get, the more front load you're going to get, right? And then finally, number three is really just going to be learning how to breathe and connect with your pelvic floor. So as you inhale, you should kind of feel like a gentle fullness in your pelvic floor. Like it's very subtle, almost like a balloon kind of filling just lightly and relaxing. And you can try that in different birthing positions and kind of seeing, hey, which feels good, which doesn't, and playing around with what feels good with your body now, because it will likely be emphasized as you become larger, your belly.
It feels good, meaning you can relax the best in that position, or like what determines that it's like a good
Like
position?
maybe it doesn't cause pain, or you're just noticing. You're not even, most of the time, if you've had scoliosis and you've been working, you may know certain positions that aggravate, right? So just kind of play around with the weight distribution and kind of see, okay, well, if I'm holding a weight out front, how does that feel in that same position that I keep getting irritated in? And can I shift forward more? Can I shift more onto one side or the left? Rotate. Does that make sense?
Yeah,
So you're
yeah,
just kind of playing with different movements and bringing awareness to your body and kind of checking with what works for me and what doesn't. I know it sounds kind of vague, but it's more of, if certain things aggravate it, play
mhm,
with those different movements and see, and then work to kind of build up your strength from there.
yeah. Um, if people want to follow you, learn more about your services, how can they find you? Where are you at? What's your website?
So my website, so if you're in the Texas area, it's resilient-rx.com. That's our physical therapy website. And then my podcast and personal brand is drmarygrimberg.com. And that's has my podcast information. It has some blogs. It has areas where you can submit for questions and potentially for public speaking options, variety of things there. And then my Instagram is drmarypt.
Thank you, Mary. It's awesome as always to have you on. I hope that if you're listening to this episode, please don't hesitate to reach out and send us an email, reach out to us on Instagram about questions you have, or even things that you want to learn about, programs that you would maybe want us to put together for you. We are open to whatever you guys need. So thanks for tuning in. I hope you have a great rest of your day. Until next time, stay well and stay ahead of the curve.